I just wanted to say it's a bit of a landmark for me personally, because it was at the annual conference last year that Peter announced that I'd been appointed as the new director. And I have to say it's been an interesting and a challenging year, but very productive. And I'm just so proud of what I think we have achieved in the last 12 months with the support from our membership. To echo Graham's point about the small grants that we're about to hear from, they really are at the heart of what we do. We work in 3 areas of research, service improvement, education and training. And we want to support innovation in each of these areas, and the small grants is our opportunity to do that. And the thing I love about the small grants is they can be quite quirky. They might be things that may not attract mainstream funding, but are certainly meeting a need that's identified on the ground. So far, we've sponsored 25 grants to date, and the 8 we're supporting this year are enormously impressive in terms of the range and the quality, and you'll see the posters up there as well as listening to the presentation. I just wanted you to know that it was a very competitive process. We had 47 applications this year, and had we been able to fund them all, we would have needed 378,000. Our budget is much more modest than this because we are funded solely by subscription. We also had a very rigorous assessment process, and on the panel we had a trust medical director, we had a director of public health, a professor of general practice, a head of commissioning for adult services, and acute sector deputy director of strategy. And the main criteria were around cross-boundary working and demonstrating a direct impact on services for patients and carers. So I'm really delighted to to have the opportunity for these to be presented today. What, on a very practical note, we would like to do is to chunk them. So if we have 3 presentations to start off with, and in my mind I grouped them around lithium, pain and alcohol, as there seemed to be a theme running through this. We then move on to pregnancy, young people, polycystic ovarian syndrome. And then we'll have the final 2, which is about working in care homes and about empowering carers for people who have dementia. So if we have the first 3 presentations, then we'll break for questions, move on to the next 3, break for questions. And so I'd like to welcome Carl to open up the proceedings. And thank you, Carl. Okay. Right.
Okay. Afternoon, my name is Carl Holvey and I'm a pharmacist at the local mental health trust, and I'm co-leading on this project with Dr. Helen Miller and Dr. Stuart Adams, and we're bringing you a Lithium app, which is essentially a medicines monitoring passport. For those of you that don't know much about lithium, so lithium is a medicine that was brought into the UK, and it was first used in the 1940s, and it was used for gout, and it was essentially used as low salt, so as an alternative to table salt. But unfortunately it had some toxic side effects, and people started becoming sick and dying from the medicine, from the gout treatment and the low salt, so it was withdrawn. But they found that it helped people's mood and it helped them stay on an even keel. So this serendipitous find brought us an effective treatment and prophylaxis for the manic highs and the depressive lows in bipolar affective disorder. So because the blood level that you need to reach to make sure that it actually has the positive therapeutic effect and the level at which it causes toxic effects is quite small, national guidance from NICE and the NPSA, as was then, or the patient safety part of the NHSCB as it is now, recommend that there's 3 monthly blood levels as well as other raft of physical health monitoring that's required when you take this medicine. So it's currently recommended that everyone should have a handheld record when they take lithium, and it contains all the essential information about the physical monitoring and about the supply of the medicine that's required to make sure that they get their treatment as safe as possible, so they don't get harm from their care. And in South West London, we've got some quite innovative approaches already to try and reduce the risk of harm. We've got a lithium register where all our patients are on, so we know exactly who's on lithium. We've done lots of clinical audits looking at the treatment and the standards that are required to see if we're attaining those. And we've done quite a lot, basically, and we've improved significantly, but still there's some difficulties. The client group that we're looking at can be quite chaotic, they can be quite thought disordered, and asking them to carry a handheld record to every appointment to see their GP, to see a psychiatrist, or to pick up their medicines from a community pharmacy, sort of like Boots, can be quite difficult. And we know that the level of, the amount of people that are holding that record is quite low. So, and this record is meant to improve the communication then between these different 3 professional groups, between the GP, the psychiatrist, and the community pharmacy, to make sure that they have the right information when they need it to write the prescription, to supply the medicine to the patient. So, So we've come up with this app, and it was the brainchild of the Drugs and Therapeutics Committee at our trust. And what we're hoping is this app will help engage people so they will want to carry their data with them. Lots of people, we've done some research to see if people have smartphones that you will be required to have to use the app, and they do. And hopefully the app will also contain information, clinically useful information for the service user and the clinician reviewing the patient about their mood. It'll have a mood scale and a sleep diary, and we'll be able to push messages, safety messages to the service user. So hopefully this is an important safety initiative that will empower patients and also reduce the likelihood of harm from their care. So the Medicines Management team at the Mental Health Trust, this is the second time we've had a grant from the system. And the first time was from an initiative that we spotted that we're using lots of staff that don't have explicit training in medicines and medicines handling. So we wanted to plug that gap to reduce the risk of harm from medicines, from their care. So we came up with some e-learning to plug that gap, and that's available in South West London. So we wanted to thank the system for giving us the opportunity, for giving us the cash the second time, and also for recognising the important initiatives and the benefit we can have on patient care from those initiatives. So thanks for that.